12 physicians in our group, all of whom are either board certified or board eligible. We cover all the way from the neck to the toes. We have a specialist in hand surgery, specialist in spine surgery, specialist in the non-surgical treatment of spine and other injuries, a sports medicine family physician who does not do surgery but does non-surgical treatment of patients, and several sports medicine fellowship trained orthopedic surgeons as well.
I think anyone who's had a recent injury, if it's significant enough that it's lasted more than a few days, if it's not getting better. The other thing is if you've had an injury where you felt a pop or something let go in a bone or joint, I think definitely that they ought to be seen by an orthopedic surgeon, you know, fairly rapidly, because there's some things that you can fix and help out if you see them early, and it doesn't get as good a result if you wait very long.
Well, in sports medicine, at the Orthopedic Associates, we take care of 3 or 4 of the high schools in the area, and I get referrals from the athletic trainers at these schools. And when they have an injury, whether it be in girls soccer or boys football, we are able to handle all the sports injuries that come from the schools. And we give the schools the ability to contact the physician directly and get the child into the clinic quickly. We take appointments same day. That way we can find out what the problem is, assess the injury, and determine whether there is a need for surgery or whether the athlete is able to return to their sport. So this is a great service for the schools. It helps them determine whether they have that athlete for returning to the field or whether that athlete is going to be out for 3 or 4 weeks.
It's very important to understand why the patient has come to see me. A lot of times the patients have had some treatment before they come to see a spine surgeon. Sometimes they come on their own. Sometimes their primary care physician recommends that they come to see me. But it's important to understand what they expect at the time of the visit. A lot of times they've been through treatment that's non-surgical and really just want to get the problem taken care of. Those patients are good patients to discuss surgery. Sometimes they come to me without much treatment and we have to initiate non-surgical treatment before doing anything surgically. So it's important to understand their expectations and outcomes and what they would like to get out of their treatment prior to initiating a course of treatment.
Orthopedic Associates in Central Texas have been in Round Rock for 27 years. We're part of the community. We would like to feel like that we're not just doctors in the community, but also part of the community.
I think every doctor in our practice is some of the very best in their field. There's not any weak link. I'm asked all the time, well, if I need to refer someone to a surgeon, well, who would you send to? And there's not anyone that I wouldn't send my mother to.
I think what makes Orthopedic Associates so different is the full spectrum of care offered by our group, as well as our goal of being a one-stop shop in the sense that we offer multiple different diagnostic modalities, including EMG, MRI, ultrasound, fluoroscopy, as well as physical therapy.
I think for Orthopedics Associates, our customer service and our attention to patient care is one of the highest around. I think that's what we pride ourselves on is how well we treat the patients and how well trained our doctors are. The majority of our doctors are fellowship trained and they're all board certified orthopedists.